Hi, David. How are you?
I am hanging in there. I'm good. And yourself?
I'm doing good, thanks. Thanks so much for joining us today.
Sure. Happy to do so.
So, we
Appreciate the
wanted to have
opportunity.
you on. Great. Well, we wanted to have you on because we wanted to talk about some of the research that's going on at Edson College. It's something that maybe people aren't so aware of, or maybe they don't necessarily think of the Edson College of Nursing and Health Innovation necessarily as a research, doing research, but we have quite a robust program. So, you do want to just kind of give us an overview of the different topics and subjects that we have research wise?
Sure, I absolutely. I'll try to give you just a few examples because to try to go through all of them would really take more time than I'm sure we have today. But I think what I first would say is that we do everything from discovery in the sense of understanding more about a phenomena or like sleep. For example, we have several sleep researchers better understanding the mechanisms associated with sleep, what interrupts sleep, what's good quality sleep, and the like, and how chronic illness interferes with that. So, understanding that to people developing, piloting interventions to help youth with obesity, people looking at issues associated with alcohol and sexual aggression and sexually risky behavior, to my neck of the woods, which is developing interventions that reduce stress and distress among family caregivers of people with Alzheimer's disease. And then, not only in terms of discovering and understanding those, but then beginning to test those and then moving them out into the community if we haven't already done so along the way.
And to that end, we have four different centers within the college. I'm going to read them just so that I get the names correct because I do not want to mess this up. So there's the Center for Health Promotion and Disease Prevention. We also have the Center for Advancing Interprofessional Practice, Education, and Research, the Center for Mindfulness, Compassion, and Resilience, and then finally the newest center, which is yours, the Center for Innovation in Healthy and Resilient Aging. So this is your baby, your pride and joy. So why don't you tell us a little bit about what SEER is about and what you guys, some of the big issues you guys are hoping to tackle?
Sure. So, Sira, first I have to thank the Provost Searle, and the chief innovation officer and executive vice president of the university, Ponch, who helped provide the initial funding for this center. CIRA is really focused on tackling some of the key issues in aging, but doing so by bringing together very varied groups of researchers. So, what we did is develop a platform of seed funding where faculty have to come together from different colleges and different disciplines to tackle a key problem. So, we have people tackling issues associated with gait and movement in individuals with Parkinson's, or just people who, as they age, are having more problems, developing technological advances to try to address those, to people understanding relationship quality and that impact on our gut microbiome, because we know that that has increasing. Or we're increasingly interested in what that impact is on health, to people looking at new innovative ways to address stress and distress in family caregivers, like I mentioned before, through improvisational kinds of techniques. So we're really interested in looking at a variety of issues associated in aging. And so the gate is really wide open to begin to let those kinds of issues resonate with faculty and then begin to address those. So we've brought together interdisciplinary advisory boards, both internal and community, because we're very interested in staying close to the community and hearing from the community about key issues that they want to address. And so we're very excited about this launch, and we already have teams working together to address this. And then what they have to identify too is a national call they're going to go after that's going to expand that research further. Draw in additional people, and many of them are already working with community partners to really hear the voices of those individuals, and have that represented in the research that we're doing.
And that's one thing that's really key, I think, about all the research that we do is that it is very community focused and oriented. I mean, we're obviously our research participants come from the community, but the idea is to create interventions that will create healthier, better outcomes for people, right? And that kind of makes our college unique because we are dealing with people all the time in research, right?
I think it's very true. I mean, we're not the only college, but I think we do it in the health space in a way that not that other colleges may not do it. I think that we bring again a variety of disciplines together, and of course, with CIRA, we're drawing not just from our college, but from other colleges. So there's increasing interest in doing that. We're also reaching beyond our college and addressing what ABOR would like for us to do. We're working with the U of A. There are people that are investigating how to have ties with NAU. How do we bring those together, as well as community partners, both our clinical partners, places like Mayo and Banner and Dignity, as well as beginning to look at social services agencies and organizations that are heavily embedded in the community and serving the community, whether that's the Alzheimer's Association local chapter, whether or not that's Duet and the local area agencies on aging, and many others. So again, it's something I think we take some pride in, even if we're trying to begin to understand a phenomena and the mechanisms that might make interventions work. We're really trying to hear from the community. And not just in a way that that person is a participant, but also hearing how they might want to shape the research. And we do that in a variety of ways. And I think we take a lot of pride in that. I think we also take pride in looking at how we are going to build the pipeline of researchers and how do we do that from the undergraduate level to the master's level to the doctoral level, and then have those people have that kind of fire in the belly for research that will be the new researchers. And even if they decide not to go on and be a professor, do they have a good solid understanding of research, understanding of science that's going to help shape our communities and better our communities in that dialogue with communities. And sometimes it's a difficult dialogue and we work through things, but it's very exciting to do that.
And you do this personally too. You're not just the associate dean or the director of the center, you are also a professor and a researcher. So, do you want to talk about some of your personal projects that, well, personal, but your projects that you have going on?
I'm sure I'm happy to talk about some of them. I've been very fortunate to be funded through the National Institutes of Health, National Institute on Aging in particular, but also through the U.S. Administration for Community Living, through the state of Arizona, the Arizona Alzheimer's Consortium, and other foundations to be able to continue my work since 1995. And so examples right now that we have going on is given the pandemic, we are taking some funding that we have, and we are looking at how we take some of the programs like CarePro that we received some awards for, national recognition for, and how do we flip that from face-to-face to Zoom and still have similar kinds of outcomes. We have a project that's going on right now that is really looking at people in the early stages of dementia and their care partners. Again, we're working with the NIA now that we're in the pandemic to figure out how we do a combination of Zoom and telephone to go ahead and deliver that was face-to-face. But we also have a U.S. Administration for Community Living Dementia Capable System grant that is targeting three different underserved populations, primarily people living alone with dementia. Growing numbers of folks are doing that, living by themselves and struggling with memory problems and advancing changes in cognition. We are looking at the underserved Latino community, and we're also looking at people who have Down syndrome or other intellectual disabilities who are developing dementia as they age. And in the backdrop of this, of course, looking at their family caregivers, their friends and family who are helping them through this journey. We do that through workshops. We do that through for providers and for the community, informing them, educating them about what's going on, but also through the interventions that we've developed and tailored now for those particular underserved groups.
It's an interesting time, right, for all of our researchers and for you too, as people try to pivot to continue that work as the pandemic is going on.
Absolutely. And we're doing it in different ways depending upon who's the population. As you can imagine, with with older populations that have memory concerns, with providers that work with them, it becomes very challenging to think about doing those kinds of things out in the community. However, if you are working with a clinic, a hospital clinic, a primary care clinic, and you've really worked through what we call the Institutional Review Board, Human Subjects Protection, to be able to do some of those kinds of things within the parameters of the clinic during some time that they're already meeting with those folks, then maybe there's going to be some kinds of that face-to-face still. But other ways, we're trying to figure out how to flip it. And we're going to learn. I mean, this is the age where we are advancing a lot in telehealth. And that's very exciting. We need to be able to do that. We need to be able to do that for, in my own sphere, working caregivers. It's hard for them often to attend some things face to face. So we're learning, how can we do this to better serve working caregivers? How can we do this in the rural areas? Although we struggle a bit with the bandwidth of the internet and how to do that, but we're learning new ways to do that to better serve folks who may not be able to drive to an intervention. And so how can we serve them more effectively? We're also learning about people that are, because of their functional impairment or because of multiple caregiving responsibilities, from kinship care, where their grandparents caring for grandchildren in the home and at the same time caring for a spouse that has a dementia. That's really about a lot of overload that they can't, again, get somewhere else and be there. And with a combination with some of our community partners like the Arizona Caregiver Coalition, how do we have consumer-driven care come into the home? A granddaughter who is older come in and be with the grandchildren while this person can participate with an intervention. So there's so many things, even with these challenges, that we're learning right now in real time out in the community, even though we may not be present in the home or present in a community-based organization in the same way.
So some interesting takeaways coming as a result of the pandemic that may actually serve you even better in the future if you're able to sort of pull these off or make them work.
Right. Well, and just as importantly, serve the community. Not only help us better understand what to do as researchers and how to, what works best for whom, right? But so that people have choices, but also to have choices for community-based organizations. In my own work, I try to embed my interventions into community-based organizations to improve access and delivery more quickly, rather than the longer time it often takes to translate, by embedding them from the get-go into community-based organizations and training them how to do it. So we're going to learn how it works for those organizations as well. So it's kind of the provider, the community as a whole, individuals within the community, and then, finally us as researchers to continue to advance our understanding and do better out there.
Great. Well, we covered a lot of ground. Is there anything I didn't ask you that you think is important to mention or add, either about what we do at the college as a whole, or at the center, or with your own research?
I think there is one thing that I touched on a little bit, but probably didn't expand on. And I think that given our commitment to be embedded in the community, given our commitment to have use-inspired research, given our commitment in these design principles of the university to move from local to global, we also have a very strong commitment to look at how do we serve the diverse array of our communities, as well as our larger community that is multicultural in nature. And how do we do that? And I think there's a strong commitment in our college to do that. And I'm very proud of our researchers and all the different types of ways that they're approaching this, to be able to improve the quality of life of individuals. This is what we're doing. And even in CIRA, while we talk about healthy and resilient aging, we believe that even at the end of life, when we're working with folks to have a better transition, we can still have resilience, in the sense of the resilience of the family, to make that transition for those individuals the very best that they can be. One of our projects that we did with the Phoenix Symphony and certain long-term care facilities, where we went in and looked at the impact of live music on people with advanced dementia. I will never forget that at one of these events, there was a hustle and bustle, and it's not unusual for sometimes some of those folks with advanced dementia to not attend a particular event, but we saw a hustle and bustle. And at the end, in the debrief, what we learned from the staff is that family came in, staff that were not engaged with us in this activity with the other residents went into a room where a woman where music was a very important part of her life. The family asked that the doors be opened and that the last thing that she heard as she passed was the Phoenix Symphony playing. And so those kinds of things that may be different than you'd ever anticipated to provide that kind of opportunity for folks. Yes, we gathered data and saw changes in people's behavior, their moods, and even biomarkers of stress of these individuals with dementia, as well as the musicians themselves. But there are also these stories that are hard to capture in that kind of data, but that are real. And that's one that I will remember for the rest of my life.
Wow, it's really important and incredible work that all of the researchers are doing, including yourself. So we appreciate you taking the time today to share a little bit more about what's going on at Edson College. One thing I did want to, one final thing, if there are people who want to learn more either about CIRA or about maybe participating in some of this research, do we just direct them to our website, or do you have a specific location you want them to check out?
I would just direct them to our website that has the different centers on there. We are continuing to update our websites and improve the access. We're going through that right now for community, both providers or administrators, as well as potential participants themselves or members of the community that want to know more. We're trying to improve that access for them. But right now, they can start there, definitely, and look for what centers interest them most, and there's contact information there for them.
Okay, great. Well, thank you again, David. It was great to see you. Great to chat with you a little bit more about what's happening at Edson College. We appreciate it.
Well, thank you.